Welcome back to the channel, guys. I recently did a panel for heart disease in particular with everything that's going on in the world. And there were some great takeaways from that, so I wanted to talk at length about some of that. During my career, I saw plenty of people who came in very late in the disease and ended up having a massive heart attack, and then we had to take them urgently to the operating room, bypass their coronaries, and save their lives. The ideal would be to recognize the symptoms in advance, and then after recognizing what symptoms are there, as well as what your risk factors are for disease, getting treatment early in the disease. In doing that, we'll have the best outcomes. But let's talk a little bit about the disease to start with. 18 million people a year die of heart-related and cardiovascular disease worldwide. Many of these are from heart disease, some are from strokes. When you compare that to the current crisis that we're in with COVID, only about 1 million people worldwide have died, and that may go up. But what's resulted from that is that many people don't go in to see their doctors because they're afraid of going to the ER or going to the hospital and getting treated. As a result, the mortality from heart disease this year may be drastically higher. So what I'd like to do is kind of spell out the things you ought to look at. The first is, what are your risk factors for heart disease? The major ones are high blood pressure, a pre-existing history of heart disease, obesity, a history of tobacco abuse, and a family history of heart disease. These all give you a higher than usual risk of getting heart disease. Now, the next thing that you have to worry about is, what are the signs and symptoms of heart disease that you should be worried about? The interesting part is, up to 80% of patients will get symptoms, and they can include chest pain radiating to your arm, shortness of breath, as well as sweating and/or other symptoms associated with that. Now, these can be at rest, or they can be with walking or exercise. In either case, you should be evaluated because there can be a number of things which can cause that. Additionally, in 20% of the patients, they get irregular or atypical symptoms. And in particular, if you have diabetes, which is also a risk factor for heart disease, these patients will often present with indigestion, bloating, or other atypical type symptoms. I think if you can recognize these early and come in to be evaluated, additional physicians seeing you, getting a good history and an examination, and doing the appropriate testing, then intervening would be possible. So the take home from all of this is that it's very important to understand the risk factors for disease. The second is to understand what the symptoms are. Later, we'll talk about what types of therapy are available for treating heart disease. Enough for now. We'll hope to see you back soon. If you have any other comments, please leave them in the comment box. And as usual, if you liked the video and learned something, hit the like button, and certainly subscribe to the channel so you can see other videos from us, and turn on the bell icon so that it'll alert you when a new video comes up. Thanks for joining us.